Computer. Hi, everyone. How are you today? This is Dr. Selena from CVAMS. This is Island Pulse, the Cape Verdean Health Dialogue Podcast, Episode 9. We are pleased to present this series that embodies the principles of integrative health. This year, we focus on the impact of stress and explore techniques for managing and calming our nervous system. And today, we have the celebrity mental health person who's internationally known, Dr. Oh, well, I'm sorry, Mr. Carlos Samido, who will present his work on suicide prevention and interventions and the stress upon the individual and family and perhaps the provider as well. So, Carlos, thank you for joining us today. It's always nice to see you. We look forward to hearing from you and on this very, very, very important topic. Um, so let's just start off right now with just telling me a little bit about, or telling us, I know everything about you, I think, telling us about yourself and what you're doing and the work you're doing here and abroad with suicide.
Thank
Awesome.
you for having me, Dr. Selena. Thank you. I feel honored to attend this podcast. It actually is a pleasure to be with you in this work in suicide information or prevention. My name is Carlos Semedo. I've been doing therapy for over 25 years now. I originally started to do psychology in Portugal, come to the United States since 2005. I've been a teacher, I've been a police officer, I taught at the university psychology. Now I'm mostly doing trainings to police officers here and abroad. Right now, for this today event, I'm going to be talking about suicide. So I don't know what's you want me to continue to do it. What's
Well,
you gonna be
let's
questions?
let's let's just let's move into, if you're ready to get started,
Hmm.
we'll move into
Hmm.
maybe what are some of the warning signs we often miss
Hmm.
with
Yeah.
suicide,
Yeah,
individuals.
so I'm gonna take it like a step back to kind of a little bit talking about suicide itself. All right, suicide is kind of intentional acts to end one's life. All right, so often like is connected to mental health illness or sometimes trauma or life events or stresses come out to people's daily life. So is this suicide is kind of event globally, like according to the World Health Organizations, are around like 700,000 people die every year by suicide. So is number is very high. If you do math, 40,000, 48,000 mostly die by suicide, like globally. In Quevedo, is the number we don't have like the number the late number for 2024, but as a 2019 the number was like 45 to 50 people die by suicide. For the population we have, it's kind of high because only 500,000 people, if 45 to 50 die by suicide is a huge number. So it's concerning, is not alarming, but it's concern is a situation we need to work on. The signs doctor talking about is different, is for many reasons. Sometimes just like I said, in mental illness, is substance use, trauma, chronic traumas, for example, isolation, stress related, financial situation, hardship. All those events can cause the people to use that methods as a cope or as a scapegoat for what they suffer in that moment. So the one and those people mostly they give you some signs before they commit they try or attempt suicide. So they talking about that more often. They feelings like hopeless, all the negative thoughts about life, negative thoughts about themselves, negative thoughts about everything they ever done in life. They withdraw for the major events. uh, for example, they like to go to movie, they don't go no more. Like to go to parties, they don't go. They kind of isolated for social media, and I even talk to no one. They start to sleep more or less, depend on whatever situation they're facing. The appetites change up and down. They give away their belongs. There's a huge sign we need to pay attention to. They give away they belongs when they feel like when they close to try that, they give their belongs. So it's important for people to pay attention to that. So on the symptoms though, is mostly is connected to persistent sadness. All right, people's been feeling this for some time. All right, or the anxiety has been in their life for a long period of time. The mood swings. They have one have feelings right now. 10 minutes later, they might be sad. All right, or today they're doing okay. Tomorrow not so good. All right. They have some signs or signs of fatigue. They're always on edge or trying to do things. We're talking about feelings like sad most of the time. They feel like worthless, so they feel like I have no importance in this planet. I have no importance in this life. So what's the point of me stay around, for example, right? So on the suicide, this is mostly talking about a little bit about history, about statistic, signs and symptoms. I don't know if you have any specific questions
All right,
or.
tell us about prevention. Let's talk about
Mhm.
prevention because that's really
Okay.
important. 'Cause I
Yeah.
know that you've
So
got a
on
lot of
the
experience.
intervention part of it, the first thing we're supposed to do is therapy. Therapy is a good intervention for people
No,
with
no,
this.
prevention. Because we're talking about, looking at how family,
Mhm.
we can talk about interventions after this, but what is it that we should be thinking about in terms of prevention? I'm sorry.
So in preventions, we can like it. For example, they go hand to hand in prevention intervention sometimes. All right.
Okay.
So it's talk all signs. All right. So it's take all signs like seriously. All right. So we can prevent that. Like when people say it's gonna kill themselves, take it seriously. Don't take it as a joke. All right. So it's gonna be an intervention you can use right there. Right. Don't leave this person, for example, alone. If you know someone's have suicide thoughts, do not leave them alone. All right. So it's, on the prevention is trying to when you're doing therapy, as I was saying, like doing therapy, you're going to prevent in many ways. People's going to talking about what we're going to vent about their thoughts and feelings about what they're going to do next about life. So there we're going to prevent it right there, like how we're going to prevent someone's to die by suicide is making them feel like you're important, right? You need it, you worthy, all right? So those thoughts, try to taking away those negative thoughts, change it to more positive ways of seeing life, see themselves, and then making them feel they're worthy.
Can you share with us? I know that you have had various interventions in very significant times when somebody had actually done that in front of their son, and you
Mhm.
also had a time when somebody was about to, and you actually prevented it from happening, I
Yep.
believe, if I'm hearing that correctly. Can you just,
Sure.
without any, giving away anything that's confidential, of course, could you
Mhm.
just share what that experience was like?
Yeah, so definitely it's traumatic experience for you to kind of hold someone's legs to make sure they're gonna die by suicide because they're hanging already.
Mhm.
The reason must be varies, as I said at the beginning, is different reason for people to do that. So the interventions get, like I said, is trying to to listen to those people when they're talking about they need to be heard, they need to be feel loved or feel important, feel like they're part of this family, they're part of this society, this part of the group, so you're not alone, right? So with that said, is not let them be alone when they try once or they have a thoughts of die by suicide, right? Encourage them to seek professional help, all right? Encourage them to call the numbers, whatever number they have. For example, here we have a 911 number, right? In Quevedo, you have like 132 for the police and for the firefighter. They, if they have different thought, they can call hospitals, right? They have a numbers now for hotline in Quevedo for them to call, for example, right? You promote open conversation about stigma, for example, right? The stigma is another huge stuff happen. Bullying, for example, right? Once people feel like less bullying, it feel less stigmatized about their life, it might be a good interventions, preventions they can use in their way. An intervention side, more deeply, not just the prevention, but interventions like how can we help people that remember I said therapy, right? If people have some psychosis, is worth to talk with the psychiatrist for medication, for example, right? So it's supposed to have like a contact to crisis line. It's safe to plan it, for example, right? Hospitalization if it's needed. Someone's like on the edge, maybe we can hospitalize them to kind of save their lives. All right, supporting community in among their families, among their friends, for example, right? They needed to feel like supported, loved, heard, and feel important of their community.
How, so again, when you were able to observe something like this, what did you do to help the family
Yeah.
actually in that moment?
So for the specific event I witnessed, I was at one place in Praia, and then this guy can hang himself. People start to yell, and then I ran to that direction and found this guy still hanging. I lift his legs, and then somebody has caught the knots, uh, the rope. After that, he was transported to the hospital. All right, so he luckily is still alive. So after that, I started to work the family, kind of providing support in this sense. Therapy, not therapy because I cannot do therapy because I'm just going to be there for short period of time, but I providing support and then guidelines what they should do after that, right? So
Mm.
the family involved, it was a group of people. I was talking to them like about the education about suicide, what they should do when things happen like that. So who they're supposed to contact, all right? Create a support team, educated them about the cause of it, like if this person is depressed or whatever case may be, like what's life, what traumatic life event happened in this person's life, that period. So for them to pay attention, he loses his job or the relationship is divorcing, for example, right? Family member died. He knows someone's close to die by suicide. So all those things need to bring it up and then talking about. Another thing I wanted to clearly point that out is it's kind of taboo. People not supposed talking about suicide. No, it's contrary. We're supposed talking about it. All
Mhm.
right. It's encouraging people talking about if you have a thought, do not hide. Talk to people about it. All right. So it has the best way we can prevent actually, not the best way, but one of those is encouraging people to talking about their thoughts openly and not feel they're not supposed to feel judged, all right, about what's they been shared on their thoughts and feelings about it.
What do you think the families should be educated on? Uh, is I don't know that there's a platform for them to be educated on how to interact or how to, um, most of the time it's more like sometimes they brush it off or they
Mhm.
just tell them that they'll be okay, just, go get some
Mhm.
rest or parent, sometimes it's hard to even think about that you want
Sure.
to intervene with that. What, how do you think families, or how can families get educated on things that they can do to really understand the signs and really, look at this more significantly? Because by the time they get to the point where maybe there's that calm before they have this, after they've had this major explosion, and now they're calming or they're talking about death, like you said, or, um, families might say, oh, they're quiet now, so they're okay. But really, they might really be making the plan, activating the plan. How
Yeah.
can we
So
help families?
actually, yeah. Sorry, it's go back to what I said before. Like, is talk to them openly about their thoughts about suicide. All right. So make it someone who has this tendency, make them feel comfortable enough to share their thoughts and feelings, even if you have a plan to do so. Right. So it's not judging, it's not criticizing, it's not cutting them off when they start to talking about things. You leave them, let them like express. All right, create a room, create a space, safety space for them to openly, honestly share about it. If you don't feel comfortable, like if they are still have this, tendency, like sometimes people like have like empty vision. They just sit down, see, not seeing anything, just long vision, but they kind of empty. You call them 3 times, they're gonna for example, right? So they kind of they stay physically, but mentally they can in different place. Do not leave them alone, for example, right? Make sure someone's going to be with this person, like if it's necessary, 24/7. All right, is I know it's not possible, but at least to try to make them feel like with someone around. All
Mhm.
right.
But if the families don't understand that, or they're not been educated towards it, or they really don't want to even think of it, like you said, the stigma, um, what is it that we as therapists, I mean, I wonder if the signs are because of the stigma, all the signs, will they talk about it, I guess, even in the United States, will they talk about it and get the help that they need before and learn how to intervene to
Mhm.
maybe, I mean, I had a case where the son talked about this with his mother constantly and talked about death a lot and eventually went to the garage behind the house and she found him there hanging. And it was
Mm.
devastating for
It
her.
is.
And
Mm.
so again, I guess what, maybe the other question really is this is a very complex grief, right? Very traumatic,
It is.
complex grief. And how do you intervene with that then? Let's maybe move over there.
Yeah. Definitely, definitely is complete grief in that way. Educated family is going to be much easier to educate the society for reducing the stigma, right? At
Yeah.
least in the family, you have this loving, if it's your brother or cousin or father or auntie or uncle. So at least you have those close family relationship, all right? So educate the family in those things we discussed before, Dr. Cillian, is that like to pay attention to signs like people like
Mhm.
not showering for days,
Yeah.
people's not changing clothes anymore, right?
Mhm.
Or people's give away their belongings for them. So all they all signs people should pay attention, or people often talking about I'd rather be dead than alive. So this thing's gonna be over soon, all right? Those language people families should pay attention to those language. As I said, it's much difficult to educate the entire society, but if every family member who has one person who he's having these suicide tendencies, we help that one. Maybe we're gonna embrace more families together, talking about more openly nationally, for example, right?
Yeah. So I just, I wonder why this is such an epidemic, across the globe. And are we not talking about it enough, really? And is there not, I don't know. I mean, there is the hotline, there's the crisis center. We tell families to remove all the objects that they might be thinking about using or not thinking about using, remove them anyway
Mm-hmm. Mm-hmm.
when we're working with them. But if they don't have somebody in there, they don't have a therapist, if they don't have the means of having that education. Um, so these things, kind of happen and it's horrible. But
Yeah.
is there enough out there, even here in the United States, do you think? I know that when we had a meeting once in Cape Verde, that you had some really
Mm-hmm.
great ideas about what should be happening so people can have ready access to someone immediately. Um, and I
Mm-hmm.
don't know, is that ready access really available? And do people really use the hotline as much as they should, or does it really help? I mean, I'm sure it does, but I mean, does it help everyone? I don't know. Um, where's the link missing? Sounds like there's the connections. There should be a lifeline, you know what I mean? It should
Sure,
be
sure.
the crisis center has the parents and the
Mm-hmm.
parents have the therapist, no, the crisis center, or
Mm-hmm.
maybe the crisis center or the hospital or the psychiatrist or the primary care doctors. We're talking about integrative health here. So
Mm-hmm.
we have other people who are also involved as providers that we all have a link together. So
Mm-hmm.
that's not that place is not
Yeah.
skipped. You know what I'm trying to say?
Yeah, no, I do. So suicide is in a is it's kind of event like so sad. It's a traumatic event, as we said beginning, that take away like 70,000 life every year.
Yeah.
Like even in the United States, in Europe, around the place, this is a global epidemic we have that is almost impossible to stop. So the main key is going to be work on reducing stigma, bullying, or make people feel more comfortable to come forward when they have those thoughts to attend therapy. All right. Even therapists, we cannot do much when people like decide to do so. We try to prevent, try to work with them to see the positive side of life. But how are you going to teach someone to stop thinking about negativity, for example, right? He lost his job, right? He's go home and then fight with his wife, and then the divorce is pending. Family member died, right? Whatever case. So your life is so dramatic affected that way. So it's going to be tough, almost impossible for to stop someone when they decide to do so. But your goal is to work on educating people about it. So you're not alone, right? Make people feel comfortable. Make people feel like loved and cared and belong to the society where they are living in, right? So it's continue to work in educating people. Hotline is going to help when you feel some type of way is you to contact someone, right? Because those people who's asking for help really didn't want to die. All right, they need help. All right, if they call hotline because they have these thoughts about to kill themselves, but deeply they don't want to die. Maybe the actions they take is to kind of reduce the pain they feel in that moment for them, like, whatever case they means they use to handle their lives, they feel that second that is the best way to stop their pain, but deeply they don't want to die.
Right, of
If you
course.
ask those survivor, they mostly they say like, I deeply don't want to die. I just wanted to stop the pain. But how can we introduce other ways to stop the pain? Not trying to use a gun or hanging yourself or jump a bridge, all the stuff. So again, is not so easy answer to that question to
Yeah,
say
no.
how we're going to prevent it.
Yeah, I'm thinking of a more systemic approach,
Yep. Hmm.
like I just think that there needs to be more links in many areas of what we do.
Hmm.
We all need to link. We need to integrate and link,
Yep.
and there needs to be more systemic approaches so that
Yep.
there's sort of a system where what one follows the other, and all of those kinds of things are coming together. Maybe that's just a dream or whatever.
No, Ash is good. So if we can integrate every this system we're talking about, maybe they work separately. If we connect it, we link it to each other. So 911 to hotlines to mental health to doctors to police officer on the street to the family member who is a primary caregiver, for example, right? So all those entities, if we connect them, we might have a better result.
Right. And I think that kind of happens when they end up in the hospital. The hospitals do try to find them a therapist before they leave and all that kind of stuff. But I mean, I
Mhm.
don't know. There has to be there's something missing.
Yeah, yeah, yeah.
Missing. What do you feel clinically? What do you feel is um, is a good source of intervention? I know that CBT is used, DBT is used, and depending upon the what's going on with that person, probably trauma. But what do you feel for with your experience, is a good clinical approach to working with somebody who has major depression and is suicidal and has had suicidal
Mhm.
thoughts for years? I mean, I have a case like that in New York, and it's difficult, especially having me and doing this. It's
Yeah. So you're right. So these days, mostly CBT is the major therapy techniques is used like worldwide in dealing with depression, anxiety, or the mental illness people's been dealing with. But you can add other stuff in this toolbox in how can help people besides like CBT on therapy or other stuff or like. Uh, Therapy is the main thing I believe we can work to help someone because therapy is going to change behaviorally. That's why we start behavior therapy, right? So CBT stands for like cognitive behavior therapy, right? The way we think, the way we feel, the same way we're going to act. If we challenge the way we think, we're going to feel different and then we're going to act differently. So if the main core is being changed, like on the core belief, I feel like worthless. I have no importance. I'm not good. I'm rather be dead than alive. If we've been able to change that in therapy using CBT techniques, definitely we're gonna get better results in taking medication because you're taking medication right now, you wake up tomorrow, those thoughts gonna be there, right? So by we change the hardcore of belief as a CBT stand for, we're gonna we're gonna have a better result in that way. So is another intervention is brings this person, for example, right? You lose your job. How in the society help you find another job? All right. For example, right, keep yourself occupied in that sense. All right. About you reading positive books or remarks or intervention stuff you can do. You play sports. You find the spirituality. I'm not saying church or religion, but you find some spirituality, some meaningful event in your life. What's important for you, right? Stay close to your family and friends. Do things you like to do the most. All right. Read a book you haven't read it forever because you have no time when you was working, for example, right? And then also avoidance substance use as a coping mechanism. For example, someone who has this tendency for depression and they use alcohol or other drugs, you might put yourself in high level of stress or jeopardy to die by suicide.
Yeah. It's well, I guess, if you put your future cap on and we look at tomorrow and we look at all of the devastation that's coming down through our lives, with so many changes and people, jobs being shut down and schools losing funding and our children not maybe may not end up getting, meals in school or, who knows what else is going to happen. Medicaid might be cut back. I'm sorry. How can we, what's what does that cap, your clinical cap say to you about the fear of suicide in those kinds
Yeah,
of situations? It's like almost like another
yeah,
worsening pandemic.
yeah. So as of right now, we're living in kind of unknown territory, like politically, right? So it's not just United States, but I believe it's everywhere. We not feel like comfortable politically and the decisions make. That's gonna exacerbate the depression inside in everyone. Everyone's anxious, for example, right? I do work with the people's immigrants when they come to my office, shaking and crying and kind of stuff. So definitely it's not easy to deal with that. I mean, as an immigrant myself, all right, in the United States for more than 20 years now. I know this up and downs on political arena, up and down stuff. I don't talk politics. I don't like
No,
politics
no, sure.
myself. But again, this unknown territory we are in right now. Medicaid, educations, and immigration, and all those stuff, even security, is definitely is gonna make this situation even worse for everyone.
Yes,
Whereas this
everyone.
tendency, like people come to America for better life after 5 years, for example, still not documented, for example, right? Feel like I'm going to be deported, definitely is going to exacerbate your thought process if you have that in your mind. Definitely something we need to take in consideration and then take it seriously and then kind of suggest or encourage those people to seek therapy, right? If you attend one, make sure you stay. If you don't, try to find a therapist nearby and then you talk it to get the support you might need.
Carlos, this may not apply, but we've also seen a very high increase in mass shootings
Mm-hmm.
and mass murders. And
Mm-hmm.
then, they're killing, arbitrarily killing just people for, sometimes it's for the color of their skin, sometimes it's if met at their school, whatever that might be leading to. And then
Mm-hmm.
they kill themselves, or they get in front of the police officer and they get shot by the police officer.
Mm-hmm.
They're trying to, you know, be
Mm-hmm.
forceful with their own weapon. Would you think that's another form of suicide and homicide? I mean, it's definitely
Yeah,
homicide, but
good question. So definitely, actually, in a police officer, in the police language, we said he died by cop, right? Suicide by cop. So
mhm,
you have your plans. This life is not worthy. I'm not gonna go by myself. All right. People have those
mm,
questions, for example, those thoughts. I mean, so they okay. I'm gonna die, but someone's gonna die with me. And then you go, you cause this mass causality in child, adults, in church, school, wherever you go. It's
right,
crazy way of thinking, but we have
right.
many more people doing so. This year alone, we still in May is more than 300,000, 300, I mean 300 like mass shooting in the United States. This is crazy. It's
Crazy.
more than once every day.
Wow.
So again, it's definitely it's a high number. Those people did not go. Mostly they don't go to get home alive. They know they're not never gonna get back home. So Or you're gonna go prison for the rest of your life, or you're gonna get like, he died by peers or whatever people's might encounter on the street, or by the police, or simply you're gonna the legal system is gonna kill you later, right? So either
Exactly.
way, your life is ended. So again, the pain that they might suffer in that moment is greater than the real reasoning to what they're doing. For example, other people, they just, skinning the other people's color. They feel like they're more, they're superior to other people, right? So you deserve to live. I'm gonna kill you. So those mentality is still being. We don't have like a science want to explain it, that scenario. We still don't know. It's just you see all the races inferior. You're just gonna go ahead and do whatever. But meaning at the end of the day, you're gonna get killed also either way, or you're gonna go to prison for the rest of your life. You're gonna get killed by your peers, or you're gonna get killed by the police officer or by the system. So again, that is it's kind of hot topic. I don't feel comfortable
Sure.
discuss those things
Of
because
course,
definitely stuff.
but it's definitely real.
It
It's
is, yeah,
definitely
it is.
real, and it
Yeah,
may be another way of suicide. Unfortunately, it's also homicide.
yeah,
It's I mean, I see so many shifts in our consciousness. Um, and I don't know, as a police officer, when you were a police officer, and I know you still do a lot of work with police officers now globally, at least abroad. But I think that what is it that is I mean, causing this lack of unconscious, or this unconsciousness, where this, like, it's almost like, the soul is missing, and you're just reacting. And I think I'm thinking about the young man who shot the CEO in New York,
yeah,
and so many other instances like that. People running down the street and just stabbing people randomly. What happened to the soul? What happened to consciousness? Because it almost makes suicide and homicide like just another fairy tale, another story to tell,
yeah,
another drama series, another horror
yeah,
movie.
yeah.
I mean, I don't know if
So
you have any points
mostly,
on that. I mean, I'm not asking you,
yeah.
really, I'm just
Mm. Yeah, the
saying.
question, I read one book a long time ago, says like we are good most of the time than now, right? So in order for us to cause harm to other people, we need to find a way to justify that. So mean like sometimes it's not even real, right? For example, when you go to about skin color, what make you feel like you more important than other people? You need to suspend your goodness for you to cause harm. All right. Mostly one people it's kill each other, is kill other people. Is like for that second you're gonna suspend your goodness to do the harm, to do the bad stuff. But sometimes even conscious for those 2 seconds, all right? So when you recover yourself and you be arrested, you're gonna go to the jail and then you sit down, you put your head down, you're gonna start to cry. This is
Mhm.
I witnessed many times. People
Okay.
do crazy stuff. One day in custody, you still start to cry and apologize and regret for the action. I don't know what I did it and kind of stuff. But again, the harm itself is caused by some negative projection or negative analysis of life that moment. We're doing things we're not supposed to, and 2 seconds later we regret about it.
Yeah. I mean, it seems like it used to not be this bad. It was bad.
Yeah,
We've always had crime, but this has become soulless crime.
yeah,
It's
it's been
very
it's been
scary. Since
soulless.
the
Yeah.
pandemic, it's become soulless. But I know only have about a few more minutes, so I wanted to
Mhm.
ask you, just in terms of like all that you just said and all that you know and all that you've seen, how do you take care of Carlos?
Thank you. Good question. So on the self care is very important. I'm a kind of easy one to talk to everyone. As you know me, I always ask for help, talk to people. I my coping mechanism is family, friends. I do still play sports, talk to positive people. I'm going to always use my spirituality as my main go-to. One day I have no power, mostly find myself on the floor and ask God for guidance and direction. My self-care is like trying to sleep the most I can. I'm a good sleeper. I try to eat healthy, as I said, go to the gym every day, mostly. I didn't go today, but I went yesterday. I'm going tomorrow for sure. I like to stay active in sports and go out, friends. And I don't drink, I don't smoke, I don't do none of those stuff.
Mhm.
But I love talk to people. I love to be in connection to people. So life is good. I would like to keep it that way.
Well, amen to that. And I hear you. Carlos, thank you. Do you have anything else you want to say before we close?
What I want to say, like to people to be open to talk. It's psychologist or therapy is not for crazy people. Actually, it's contrary. It's gonna help you to not helping you not be crazy. Psychologists, we are good in try to listen to people, helping people. Because if we don't go to therapist, you might need to go to psychiatrist for medication later. So you better using us now to kind of change the thought process. I believe everything's gonna go to the way the core belief we call it, the core belief. So my core belief this way doesn't mean it's right at some point. If we got some professional guidance, might waking us up and to see like I was thinking this way my entire life. That might be the case. Let me change a little bit to see if my life's going to change somehow.
Yes, I totally agree with that. I always begin my journey with people on emotional therapy,
Mm,
because it doesn't have to jump into or stay in mental health.
mm,
And
mhm.
so we begin that journey there unless we have some significant trauma. Of course, it's a different story.
Sure.
Thank you, thank you, thank you. So, Carlos, God bless you and the work that you do. And I see you when we're in Cape Verde, and you're busy and you're talking, you're on stage, you're with families, you're running across one part of the island to the other part of the island, and you really do it alone. I see you really taking on a heavy load, and really helping. So thank you for the help that you give, not only us here, but those there in our country of Cabo Verde. So thank you everyone for being with us today. We hope you have found this experience to be both enriching and thought-provoking. Um, and we would like you to stay tuned for our next episode, which is episode 10, and it'll be with the leaders of tomorrow, our young people who are going to tell us about their vision for tomorrow. And they'll be hosted by Dr. Maritza Barros. And don't forget to follow us on follow CVAMS on Spotify and YouTube. And you can find us on YouTube at CVAMS Health Dialogue at gmail.com, as well as you can communicate with us on CVAMS Health Dialogue at gmail.com. If you have any further questions for Carlos or any one of us who will be presenting to you, and thank you and God bless everyone. So we'll say ciao and obrigado, and ciao. And you want to say obrigado?
Obrigados. Yes, obrigado, everyone. Obrigado para nos assistindo. E quem que tem pergunta para mim, para a doutora Celina, e tem outros profissionais que estão na linha conosco, não nos está aberto para conversas, para perguntas, coisa que não está no nosso alcance, e não está aberto a ajuda aos calverdianos, ali nos Estados Unidos ou noutra parte do mundo.
Verdade. Thank you. Prazer. Tchau.